Lebitso la ka ke Mme Nthoise Leletwao ke mookamedi AIDS Health Care Foundation Lesotho. Tsatsing lena re bile le mmoka re le AHF ha mmoho le bomphato ba rona ba media houses in the country tlasa the theme strengthening media engagement in the fight against HIV and AIDS. Mmoka ona o bohlokwa haholo ho rona re le AHF hobaneneng re bona media houses kapa media ele a critical partner tseleng ya twantsho ya HIV and AIDS tse kgonang hore di bue mo nonong ka khola ibile ho teba ho haholo ka taba tsa hore na ebe media ona role ya yona wa ona ke efeng when it comes to the fight of HIV and AIDS in the country. Re bile le monyetla wa hore ka ofisi ya National AIDS Commission ebeneneng media was put abreast on the current landscape of HIV and AIDS in the country. This has been an extremely fruitful meeting because the media had an opportunity for their voices to be heard when usually they are the ones that amplify other voices in the country on different issues. This time around, AHF provided a platform for the media houses in the country for their voices to be heard in terms of the role that they play, the role that they can play efficiently if well supported in the fight against HIV and AIDS. Motho mong a ka ipotsa mohlomong hore na AHF ke eng? AIDS Health Care Foundation ke mokgatlo o sebetsanang le twantsho ya HIV and AIDS, headquartered in the US, Los Angeles. We are currently operating in 48 countries globally, 11 of which are in Africa, of which of course Lesotho is one. Ka hare ho naha ena ya habo rona AHF e fihlile ka 2014 e fihla e kena with a focus ya ho thusa twantsho ya HIV and AIDS specifically ka hare ho sepolesa sa mmuso wa Motlotleng. Since 2014 we have essentially expanded to supporting Ministry of Health ka ho fana ka HR kapa bosebeletsi infrastructure, pharmaceuticals, as well as supplies within 23 facilities in about 5 districts: Eleng, Maseru, Berea, Leribe, Kachasnek, le Mafeteng. Ha ke se ke qetella ntate mohlomong nkare rona re le AHF re tsheditse mmuso twantshong ya HIV and AIDS haholoholo re shebile taba ya thibelo ya lefu lena, taba ya care and treatment kapa kalafo ya lefu lena le bobueleng ba batho ba infected and affected ke lefu lenana. Re le AHF re netefalletsa Basotho le mmuso wa Motlotleng hore re bile teng from the genesis of this pandemic. We continue to be standing even in the current challenging circumstances how ho tluwa global landscape ya funding ya twantsho ya lefu lenana, and we will continue to be here to ensure that there's sustainability, national sustainability in the fight against HIV and AIDS. Tse ding tsa dintho tseo re sebetsanang le tsona haholo tseo re batlang ho tseo re tshwarisaneng matsoho le mmuso ka mafapha a fapaneng haholo ke taba tsa ho bona hore we as a nation re kgona hore re ikemele in every way insofar as resources are concerned when it comes to the fight against HIV and AIDS. We are one of the biggest advocates that domestic health financing.
My name is Dr. Patrick Kanyema. I'm working with Head Healthcare Foundation as the medical director. We thank you so much for the opportunity. Today we were engaging with Media House. As you know that AHF work with various partners to strengthen HIV prevention, care and treatment in the country. Yeah, I know that my leader has already spoken why it was important to engage with Media House, but as a medical personnel, what I want to say that the country has made a very great effort to reach where we are. Because Lesotho is among the 7 African countries which has reached epidemic control. But there are some gaps, there are some challenges that we need to address. That is what the media was very important for them to know where are we coming from, where are we, and where the country is going in terms of HIV prevention, care, and treatment. So we have noticed that based on the report that the National AIDS Commission has given to us, a very comprehensive report, we have noticed also as a program that among the challenges that the country is facing is that children and adult men are lagging behind, and also our key population. That is what you can see. We are saying that we need now to come up with a new strategy, innovation, so that we can close that gap. For example, how are we going to reduce the new infection? Reducing new infection is mean we need to target men, because men are reluctant to come to the health facility to seek for medical services. So we are going to implement or want to launch a male-friendly corners everywhere in our supported sites where we work. We want to ensure that the clinic provide a male-friendly corner where bondate can come easily to discuss, to talk about their health issues, and also to target HIV contact people, what we call index testing. This is how we are going to get also some of the people who are living with HIV but who are not aware of their HIV status, and also to target, to make sure our key population are getting service. Because one of the challenge that some of the key population people are not going to get service is about stigma and discrimination. So those are the things that we need to address so that key population have free HIV accessibility. For example, I've seen that somebody with disability, he was coming to test, he was coming to get HIV care and service, and people were asking, even you. So that means people living with disability, they are not human beings. So these are the things that it's making people living with disability to remain behind because of that stigma. People believe because I'm living with disability, I don't have, I'm not a human being, that I can't contract any other disease. These are the things that we need to address, making us contributing to the barrier. So we need to address barrier to remove all those things. So one of the things also we want to do is to conduct targeted outreach where we have hotspots that we know in this community. For example, people migrating, bondate driver, in certain time they don't have enough time to go to the clinic so that they can get medical service. So these are the strategies that as a program, as a country, we need to put in place so that we can fill the gap which has been noticed in our HIV response as a country. As I mentioned, men and children, key population, they are lagging behind. So this the effort that we need to ensure that index testing are very well conducted. Men are getting their service without discrimination. These are the strategies that we want to put as a program. But the effort is not for one individual. The effort that the country has made is a collective effort to have this HIV/AIDS stability that the country is having now from 2010 up to 2024.